Even as the national lockdown continues, many states have been seeing a lot of confusion because of the government's plans. One state in the northeast, however, that appears to have prepared itself in many ways, despite not having a single COVID-19 positive case, is Assam, which is clearly showing the way. It has transformed big stadiums to makeshift quarantine centers.
Good. We do not have any positive case, although screening and testing is going on continuously. We have taken a number of steps in this direction. The first was to mobilize all the resources, special kits, that is the PPE kits, masks, and all other medicines and other essential supplies in the medical colleges and the district hospitals. And second was the training. In fact, the kind of HR manpower planning, making proper teams. But the most important of them all is designated COVID hospitals. In fact, you are aware that GMCH and all the medical colleges, Guwahati Medical College and all the other 5 medical colleges been declared as COVID hospitals.
Ratnadeep joining us at this point. Ratnadeep, we're seeing visuals of these very impressive looking facilities, quarantine facilities. This despite the fact that Assam has had not even a single case yet. Tell us what's happening.
Assam is perhaps one state which, despite not having a single COVID-19 positive case, thankfully, seems to be ready in a case there is an outbreak. That's what Assam Health Minister Himanta Biswa Sharma have told us. In fact, what Assam has essentially done is to pick up that one-liner from WHO guideline, which is prepare, prepare and over-prepare. Now, what Assam has essentially done is that it has turned at least 3 of its medical colleges exclusively for COVID patient. That would make up to close to over 4,000 beds for COVID patient. Now the entire load of general health care and other diseases would be taken up by the private hospitals. The state government will be paying the bills at the private hospital for this. So now this is a very interesting government-private partnership which has come through in Assam. Over 100 private hospitals have signed MOU with the state government to provide this service for the coming 2 months. The state government is coming up with 5 prefabricated hospitals. So there is an urgent tender which has been floated so that bigger companies who are equipped in making these prefabricated hospitals in an urgent basis have been called to bid in these tenders. Stadiums have been turned into quarantine center. We have already one stadium with 700 beds ready. A few other stadiums are being made ready, so that would be about 2,000 quarantine beds. And most importantly, one of the major hurdle for any state in the northeast, remember this region has a geographical disadvantage, so you can't really reach out to every nook and corner of this region very easily in normal days. Now you have a lockdown. And secondly, there is the poor health infrastructure, given the fact that as compared to other states in the country, the health infrastructure in northeast is not up to the mark. Even in Assam there are lackings, but the state government has worked hard to fill the gap, and that's why one of the major issue is human resource manpower. The final year students of medical, paramedical and nursing students are being trained on COVID-19 so they can have more feet on the ground. So numerous steps taken by Assam as it prepares and over prepares, as the state emphasizes, to face an outbreak if it occurs in this part of the country.